Good evening, everyone. My name is Greg Hesh. I'm a paramedic, and I am dedicating this channel to values in the hopes that we can someday adopt these values back into our society. Not that they're totally gone, but I tell you, you know that they're fading. A little background on myself. I've been a paramedic for quite a few years. I started out in 1981 in the military as a paramedic. Prior to that, I was working as an orderly in a hospital through my high school years, working with the search and rescue group and also ski patrol. So today, the topic that I have chosen to speak about, and it's kind of the foundation of where we get a set of values, is the first one, and that is compassion. What is compassion? Well, Webster defines compassion as a noun, and its definition is a sympathetic consciousness of others' distress together with a desire to alleviate it. Now, think about that. A sympathetic consciousness. That means that you are aware of this person's distress. You recognize it. You can see that they're in distress, whether it's through their appearance, whether it's through their behavior, or a combination of both. Coupled with the desire to alleviate that. So, in that, we have to look at how we go about that. And I know commonly, the first thing we do is we have a tendency to make judgment of other people. We look at that and we see their condition, we see their behavior, we apply our standards to that, and unfortunately we come up usually short by finding them less than favorable. Now, the problem with that is we don't really know their situation. We don't know their background. We don't know what they have been through in life to get to this point. And if most of us did know their story, we'd be a little more understanding. Working in the emergency room, I have experienced these people come in, the dregs of society, intoxicated, smelling horrible, dirty, angry, and it's easy to pass that judgment. It's easy to respond in a negative fashion, which only perpetuates their condition further. When I have these people come in, I usually try to calm the situation and talk to them, get to know a little bit about their story. And through those conversations, the one thing that I have found to be common is that these people feel worse about themselves than you do about them. They have a high degree of self-loathing. They feel a failure. They feel a burden to others. They are pitiful about themselves and their condition. And how did they get that way? A lot of them are trying to escape traumas. A lot of them are trying to self-medicate because of behavioral issues that they can't afford treatment for. So in that, they lose that set of values and standards that we uphold to each other. And that is what makes them outcast. I have also found that if I show these people a little love and compassion and understanding, that I get it back. I've had them open up. I've had people that have heard my words of encouragement, have taken that message, and have acted upon it. I've had cases where they came in horrible condition, and a few months later they come in with a little bit of pride, showing me that, hey, your words helped, versus verbally beating them down. And it's a sad thing, because in today's healthcare field, we have lost compassion. I remember very early on in the 1970s, when I was being trained as an orderly by these old school nurses, about the importance of compassion and respect. The nursing practice at that time was a practice of high honor, and it was very well looked upon because of the compassion that they showed for others. I was always taught to treat all my patients with the utmost respect, regardless of their situation. I was taught to give skin care, to shave these people, to feed them, to clean them, to bathe them, to groom them, and to spend time with them. And it was all done respectfully. I have seen people in my profession, unfortunately, treat these people horribly. And it is shameful that we do that, because we're in a position of trust. We're in a position where we should be uplifting to these people. Don't get me wrong, that's not every provider out there. I know some providers that are just golden with the way they treat people. But I have seen others in the profession that have lost their compassion or never had it. A lot of times I've come across physicians that were in it only for the money, and it has become about billable hours. I have seen nurses take on the job of nursing for nothing more, that it pays well. And lack compassion towards others. And that's sad, because this is a profession, the medical profession, out of all professions, should be one of compassion. If we look at the old family doctor who attended your birth, brought you up through your childhood, into your adolescent years, and into adulthood, those people were bathed in compassion for others. They understood the situations because they were there throughout your life. Nowadays, we have all these specialties, and you're lucky if you get to spend 5 minutes with a physician. More than likely, you're not. You're going to get to see their NPA or their PA, and that's all you're going to get. 5 minutes with those folks, and then you meet the physician during a procedure or something, and there's no compassion there. There's no understanding. And that's all about the billable hours. And I understand that, it's important to have the workload that they do, but we need to change this around. We need to think about it a little more. In the nursing practice, we need to think about it, about why you're doing this. Why did you get into this? And if it's not to take care of people, then you're in it for the wrong reason. I can remember one evening being parked out in front of a Walgreens in Santa Fe, New Mexico with my dad. I believe my mom was inside getting some prescriptions or something. And my dad saw this homeless guy sitting there and had his little backpack, his dog, and a little cardboard sign. And as my father sat there, he couldn't take it any longer. He got out of the car, went into the Walgreens, came out with a bag. And it was a bag full of snacks and a small bag of dog food, because he didn't want the dog to go hungry as well. And as my dad talked to this young man, I saw that young man's eyes just light up. His whole spirit lift, because someone had shown him some compassion and took action to alleviate his distress. I know that my father felt pretty good about that, and I felt pretty good about my father. So, in this channel, I encourage you to practice and take action these values, So the next time you're out there driving around or walking around and you see someone that can use a little compassion, or you see someone having a bad day somewhere, have a little compassion. Understand that they are in distress and take some little action to alleviate that. I think if we all do that, I think if we're all a little more aware and not afraid to take the actions of helping someone else, whatever it might be, even a smile, that could be it. Just a smile, a kind look. Take that, do that. You'll feel better about yourself, and hopefully they'll feel better too. Thank you, and I hope to see you guys out there. Okay? Have a good evening, and God bless.